Hi, my name is Styles Burden, and I am interviewing Michelle Samuel. She's a professor and an athletic trainer at UNLV. What made you branch out to be a professor and an athletic trainer?
So I did my master's degree here at UNLV, and I was a graduate assistant for the program director for the athletic training program. So during that experience, I was able to work in the classroom with students and help with labs, and I thoroughly enjoyed it. So when I was working clinically as an athletic trainer, I really missed that side of being able to work in the classroom and teach students. So I decided to transition from working clinically to actually teaching in the classroom.
Okay, awesome. What is your educational background?
So I have 2 bachelor's degrees. One is in sports injury management. The second one is in kinesiology. And then I went on to do my master's degree in kinesiology with a specialization in sports medicine.
What is an athletic trainer and how important are they?
Okay, so that's a difficult question. So an athletic trainer is a healthcare provider that works with active population of individuals with doing prevention, injury assessment, diagnosis, rehabilitation of sports-related injuries, dealing with counseling of athletes that have injuries or illnesses, also dealing with maybe psychosocial disorders if they're having some issues and they need assistance with that, or maybe referrals for additional resources. Mm-hmm. So they're a really important healthcare provider in kind of the sports performance world. You could work with athletes specifically that are in sports, or we can work with military personnel is a popular area as well. There's industrial athletic trainers that work with corporations. There's also athletic trainers that work with performers. So for example, Cirque du Soleil or Le Rêve, some of the shows here in Las Vegas, we have athletic trainers that work with those individuals as well. And there's many more. There's lots of clinical settings for athletic trainers. But healthcare providers is the kind of beginning, and then it branches out into many, many different things. I personally feel like they're an extremely important part of the sports medicine team because they're usually going to be that first person on the scene of an injury or an accident, and they're going to be the person that decides what happens with that person. Do they need to go to the hospital? Do they need to get referred to a physician the next day? Maybe they need physical therapy or lots of different things. So I think they're essential in my opinion,
to say the least. What type of work ethic and attitude is needed to be a successful athletic trainer?
So communication is extremely important for an athletic trainer because you're going to kind of be the centerpiece of the medical team for a patient or athlete. So it's really important that they're able to communicate to the coaches and the parents and the physician and things like that. So that's really important. As far as work ethic goes, you need someone that's very dependable, reliable, that's going to be there when the athletes are there, so during practices, competition, afterwards, things like that. So those are 2 really important aspects. You want somebody, too, that has quite a bit of integrity. So we're the ones making the decision if the athlete returns to play. If they get hurt during a game or during a practice, we have to decide, are they physically capable, and is it safe for them to stay on the field? And there's some, emotion that plays into that decision when you're looking at it from a coaching perspective or for the athlete's perspective. So the athletic trainer has to have a good ground so that they understand the healthcare is the most important piece of that decision. So they have to have the integrity. They can't make a decision kind of based on emotion or on the team winning or something like that. So I think integrity is a really important part too.
Okay. What careers are available for athletic trainers?
Okay, so this would really depend on what type of setting the person wants to work in. So I, for example, I started out in a high school setting. So I worked at a high school for 6 years as the head athletic trainer of that school, and then I moved on to teaching here at UNLV as a lecturer. So there's those 2 options, high school setting, there's the educational setting as well. We have clinical settings, so working in, for example, like a physical therapy clinic. There's performance settings, so like I mentioned earlier with Cirque and Le Rêve and things like that. Working with professional sports teams, working with, so for example, we have an athletic trainer here in town that works with MMA. So he works with mixed martial arts, and he works at Extreme Couture as the head athletic trainer for that facility. So that's a really unique kind of a position that we have here in Las Vegas that you
Yeah.
don't really see
Elsewhere.
across the nation, right?
Mhm.
So that's another one. The military setting, like I mentioned, industrial setting, and the list goes on. So yeah, so those are just some examples, but there are a lot more avenues that you can take. We have a lot of athletic trainers that eventually go into physical therapy.
Mhm.
So they'll complete their degree, they'll become certified and licensed, and then they go on to a DPT program. And then we have other athletic trainers that will pursue physician's assistant as well. So we have a lot of students that will have that desire to use the athletic training background and to branch off into another medical
Okay.
field.